I started a new job at ADT Security as an emergency dispatch operator, and unlike my previous job, which was just like 2 blocks away from where I live, I now have to go all the way across town to get to work. And so I'm on my way to work this morning, and while I was transferring trains downtown, there was a man handing out these little pamphlets, and I'm always curious in seeing what people have to say, as long as they're not too preachy or whatnot. They're just information, right? But this was kind of interesting, and so I'm going to read this out because it's just worth passing on. Ultimatum to all Albertans, published by the Silver Bullet, 6th of October 2008, which was yesterday. This is Mental Health Week in Alberta, and since 1984 we have 20,000 seriously mentally ill people in Alberta without any treatment, medication, or housing. There are a large number of these people homeless, and only the great Ralph Klein provided more homeless shelters for these seriously ill people. We at the Victims of Schizophrenia Society lobbied the government of Alberta to amend the Mental Health Act and provide the treatment, medication, and housing these people deserve. In 2006, we introduced Private Bill Number 31 to the Legislative Assembly. This bill was passed on December 2007, and until today, the mentally ill people still do not receive any help. Albertans, you have 7 days to make Alberta government accept responsibility and take care of the seriously mentally ill. Call today, call toll-free, 310-000, call Premier Ed Stylemacht, call all the MLAs toll-free at the same number. If you're impotent to get the Alberta government to provide immediate care for the 20,000 seriously mentally ill within 7 days, it will be fair to say that you're all stinking rotten rats and beasts like Stalin, Saddam Hussein, and Hitler. Victims of Schizophrenia, Alberta Chapter. Now, my first thought, after dismissing the Godwin's Law thing at the very end there, my first thought was, okay, sure, the Alberta government, promised something and didn't fulfill, which is very similar to the whole "In My Name" movement, which I'm going to link off to the side here, where all the world governments promised to end world hunger before 2015, and we're halfway there, and they haven't done anything yet. And that's fine. I was going to make a whole video on how governments should keep their promises and yada 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 yada. However, I decided to look up Bill 31 just to kind of double check. And here is a news release on the Alberta Healthcare site. This is dated April 17, 2010. I'm not going to read the whole thing. I'm just going to quote various important bits here. I'm proud to support Bill 31 and these amendments to Mental Health Act will help get earlier treatment for Albertans suffering from mental illness, says Tony Abbott, and he's the MLA of Drayton Valley Calmer. Changes to the Act will provide valuable assistance for those individuals, their families, their communities, and will be an important component of mental health care in our province. Another proposed amendment will allow community treatment orders, CTOs. CTOs must be issued by 2 physicians, one of whom must be a psychiatrist. CTOs encourage the treatment in the community and provide a less intrusive alternative to hospital admission. Each case will be addressed on an individual basis to ensure the resources are in place to support treatment. Treatment in the community will translate to a better quality of life for Albertans battling mental illness, said Dave Hancock, Minister of Health and Wellness. While community treatment orders are an important tool that will help to encourage compliance with prescribed treatment, they should be viewed as an extreme measure. Our immediate priority is to ensure availability of the support and services required for Albertans suffering from serious mental illness to lead full, independent, and productive lives. In a well-functioning health system, CTO should rarely be necessary. If passed, a steering committee with appropriate representatives from stakeholder groups will be established to assist in the implementation of the bill and to provide feedback on essential community services. The committee will work with the government in the development of options for a worldwide approach to the assertive community of treatment of mental illness. Our goal is to ensure we reach out and provide necessary assistance to those in need before the condition deteriorates to the point where they require rehospitalization, Hancock says. In addition, we assist community-based organizations and consumer groups in providing education, information, and support to patients and their families. My reaction to all this is it seems like the government is doing the best they can with what they have. This bill was passed last year. It's not like immediately everything is going to become all hunky-dory. It takes time to implement the new infrastructure and the new amendments to the Act. I mean, not even a year ago. It was passed 10 months ago. I mean, come January, we're going to get free. Like we're no longer going to be required to pay healthcare premiums. So all the healthcare premiums are going to, like, healthcare is going to be free in Alberta, like it is in many of the other provinces. Actually, it's going to be free all across Canada, from what I understand. That will go a long way to making, mental health care more accessible. And like, we had a roommate. We had a roommate in here named Natalie, and she was bipolar. And she had no problems getting on AISH. She was going to school full time and paying rent here. On her AISH stands for Assured Income for the Mentally Handicapped. No, severely handicapped. Assured Income for the Severely Handicapped. And she had a mental illness. It wasn't nearly as serious as schizophrenia is, but it's a mental illness, and she had no problems getting, AISH and paying her rent and going to school. I don't see how these people would be denied AISH if they're seriously schizophrenic. So I'm just not sure that these people are utilizing the full advantage of what options they have. And I don't think they're giving it enough time for the infrastructure that they want to see happen, that they've made sure was passed, to fully take effect. And the whole thing of, oh yeah, you must provide immediate care for 20,000 seriously mentally ill within 7 days, or what? You're going to riot? I mean, that's a scary thought. I mean, having 20,000 people all across Alberta who are schizophrenic rioting and causing havoc in the streets. But, like, you can try getting the word out without resorting to violence or demands or threats or calling us Saddam Hussein and Hitler. Try getting the word out without resorting to violence first. If it wasn't for those last two lines, I'd be all behind this. I would seriously, be lobbying for this. But to go out and attack people just because they live in this province and don't know anything about it, just because you are not getting your way, seems a bit childish, I guess. But what do I know? Yeah, I have nothing more to say. I think I've said everything that I want to say, and I'm going to end the video now.